All right. Hello.
Hello. How you doing?
Good. All right. New podcast, episode 5 now. Is that right?
Yeah.
Yeah, we're on to 5. This is pretty exciting.
Yeah.
Today we get to talk about something pretty cool, pretty novel. I think it's like we were just saying, right? It's the learning process, right? This whole exploration of treating patients post-COVID, seeing reactions post-COVID, seeing reactions post-vaccine. We've been learning so much recently, and so we're sharing a little bit about it today.
Yeah, just a little conversation about, with COVID, I think there's so much more that we do know about it now, but there's also so much that we still don't know, and so take this with just us sharing our experience and what we've studied. And the Baral Institute that we train with released a really big training around COVID in the middle of everything, just to help us stay up to date on research and what they were finding and what scientifically was going on in the body. So we've taken a lot of that education into our hands, as well as just what we feel in patients who have. We're going to be talking about after getting the virus, some long haul stuff that we've seen, long haul COVID, and then also some post-vaccine issues too. So
yeah. We have a few cool patient cases and some personal experiences. And again, some things that we're learning. So fun things to talk about.
So I would say bigger picture, if we start kind of with that, we have seen in general, if we've had a patient who has come in with X issue and started to get better, and maybe they're on a continuity plan with us where they see us every 2-3 months, something like that, what we saw was either a flare of whatever issue they had post-vaccine or post-illness. So it seemed in general like the vaccine and or getting the virus was stirring up old issues, whether it was heart-related, bladder, uterus, gut.
Digestion.
It just kind of was like, hey, I thought I was getting better, and now it's all flared up again.
So definitely the potential for obviously there's going to be some immune system response, possibly some inflammatory response to those things, right? Which is very typical when you get a virus, right? To have that inflammatory response. So definitely a worsening of typical or some of the previous symptoms. So we do oftentimes have that conversation of like, hey, this is a typical, we have been seeing this often. It's, we're going to continue to work on these things and we will make that progress again. And then the other side of that is obviously there's a few regions that we treat post-COVID infection in almost everybody that has had the virus, to aid in the immune system response, the body's recovery, your ability to adapt and heal and recover from those things. So that's when we start to talk about, we're looking at the liver, we're looking at the lungs, the lining around the lungs, especially if you were very respiratory system dominant with your infection. What are some of the other ones we're looking at? Pancreas,
kidneys respond a lot to the virus, the brain itself. One of the areas so we do a listening. We always evaluate the body when we see the patient. And if you don't know what that means, watch one of the earlier episodes. We kind of talk a lot about into that, but we're always treating what the body needs us to work on that day. But one of the areas that we will work on every single time, even if it's not a main area of concern that day, is right where the large intestine meets the small intestine. So around that ileocecal valve, there's a lot of, we'll call them kind of inflammatory response cells in that area. And so in this COVID training that we did, the professor was like, just work the blood vessels to that area. This is an area where a lot of people post-COVID infection are having lingering digestive issues, pain into the hip, pain into the back. Working that cecum area, just getting blood flow in there to help with healing.
Yeah.
And you and I have done a gluten recovery workshop, which we actually have coming up in June at Hala Daily and Just Be Kitchen. And that is very similar to what we've talked about with people who struggle with gluten. That lower right area can get
inflamed. Yeah. And even with my recent looking into more of SIBO and recovery from SIBO, I mean, that ileocecal region, it's so interesting to learn about all the intricate anatomy that is associated with that area because of, I mean, the ileocecal valve, it's not even a true valve, right? It's like that double indulation basically of the small intestine. Yes.
Indulation.
The small intestine into the cecum. And so when you have that double fold of the muscle wall, and I'm getting into some like really specific here, but it's so fascinating.
She loves it.
It's so fascinating, but you have basically a double fold of the muscle wall in that area. And so when you think about, okay, there's a double fold of the muscle wall, you have to also think double the times of the neural input, right? So you think the enteric nervous system, central nervous system control of the area, double the immune system activity in that region, double the lymphatic tissue in that region. So it's a very sensitive area of the body that oftentimes responds to a lot of these more inflammatory or, you know, these events, right, that we experience. So that even actually reminds me of a patient that I treated yesterday. So post-COVID, had COVID, what was that, 3 weeks ago? 4 weeks ago.
After his surgery,
Yeah, he had an abdominal surgery and then got COVID right after, right? So obviously we're seeing him for quite a few different things going on. The surgery went well, super, super excited about that. But then the lingering impacts of having COVID is basically what we were working on yesterday. And it was a big focus on that ileocecal region. And that was even, you know, distant from where his surgical site was, distant from where some of his other abdominal complaints were. But again, really working on improving the muscle tone around the ileocecal region, the blood flow, the perfusion, making sure the nervous system, the lymphatic tissue, all that is doing what we want it to do and really calming down so the body can continue to heal.
And if I remember correctly, is he having any like digestive symptoms or anything like that?
He was initially, but now things are improving. So he's getting back to that baseline, which is really exciting.
So I would say a lot of the post-COVID things that we're helping people with are preventative. So they may not always feel every single area that we're working on as an issue now, but when we look at some of these people with long haul issues, the hope is that we're preventing some of these long-standing issues that aren't recovering. So I think that's the beauty of it, especially if they're already have a plan of care with us. It's nice to be able to see what we can do to help recover that area for sure.
Yeah, absolutely.
And so when we look at, I'm thinking of another patient that I just saw yesterday who's had COVID many, many times, like probably once a month. And she's got some underlying autoimmune issues. And the interesting thing to share with her is every time she gets sick, it's not the same area that's flared up that needs help. So this is how interesting and complex the virus is I think a lot of it depends on the state of someone, where they're at in their menstrual cycle, where their stress levels are, what their medical history is. Sometimes, like yesterday, we worked strictly around the heart tissue and the lungs and the brain, but sometimes we've had to work reproductive areas, gut. And so I think as much as it's nice to know the research and what the virus is doing to specific organs, I think it's really cool with what we're doing because we're always going to go to where that main issue is that the body needs that day.
Again, just the importance of listening. Holy cow, so powerful.
Listen, I was at my visceral manipulation appointment recently with one of our professors, and she said, oh no, maybe this was in the podcast. You're good. Bless you. I think that was a sneeze.
Cough sneeze, somewhere in the middle.
I think it was the podcast that we listened to her interview where she's talking about listening with your hands, your heart, and your ears.
Yes.
I loved that.
Love that.
Yeah. So
absolutely.
Being very in tune with the body.
Yeah.
So a spin-off to the listening piece is So typically when we do the listening, we start with the top of the head, and then we go more specific to an area that the body is guiding us to. But sometimes we can listen at the hands.
Yeah.
If there's something specific in the arms, we can listen at the feet to check lower body.
Yeah.
We can flip someone onto their belly and listen on the back. And so I think, and I don't know exactly how this evolved, but when I was receiving treatment, after I had a bad vaccine response, I think the people in the visceral world were learning, hey, we can actually listen at the vaccine site, the injection site, and see what happens. So I think there was a lot of learning that happened during that.
Definitely.
And you've been able to do that with a few.
Yeah, definitely just like an interesting, like, hey, we have this skill, we have this assessment technique kind of in our toolbox. People are obviously responding. People respond to the vaccine differently. Sometimes it's pretty severe, sometimes it's really mild, sometimes there's no response. And I think it's really interesting as we talk about it and kind of explore down that path a little bit more of just, hey, we have this tool, let's just see what we find, using it in a little bit of a unique way. So yeah, listening at the injection site has been, again, kind of an interesting discovery process because, and I mean, again, we don't even fully know exactly why this happens or the information that we're 100% gaining from this, but with a few patients that I've had that really, really struggled post-vaccine with, a lot of times it is unilateral symptoms, right? I have a patient specifically where post-vaccine, she started having headaches behind her right eye, all like right neck tension, started having pain into her right side low back, like just all kind of this like right-sided stuff. And I did ask, was like, where did you receive the vaccine? It was in her right arm. And so I did listen at that site, and it was really interesting because you're basically, I could feel where almost like it's kind of stuck in the body, right? So basically went to the right side of her spine and around her heart and was just like stationary. And so what we start to think about, which again, we were just kind of hypothesizing a little bit of what could be going on, is, the body is struggling to metabolize the contents of that vaccine, right? Potentially. We don't really know, but maybe it's just getting stuck somewhere. And so what we're able to do is through that listening is, okay, let's see if we can help the body move this through. Let's help the body process this to see if we can mitigate some of those symptoms. So just, it's an interesting process for sure. Yeah.
And just feeling where, like having felt a few arms where the injection site was, like sometimes it'll stop up in the brain, sometimes it'll go into the chest, sometimes it goes down to the pelvic region. And it's another, I feel like it's another data point of like, okay, this confirms this is the area that we're going to work on today because this is where the body's guiding us. And it's not like we don't know vaccine response or that kind of stuff, but it's been really powerful.
Yeah, very, very interesting. Just, and we always are, we're always going to be looking for new ways to help our patients. That's ultimately where all this comes from, right? It's like, let's just give this a try. Let's see what happens. So yeah, definitely very, very fascinating. But I will say, like, with that, it's been, me personally, recently I've seen a little bit of an uptick in patients that have been having these adverse responses, or at least people that are coming in because they've struggled with their responses to the vaccine and are struggling a little bit. But like, that is absolutely an area that we can help in as well, right? Again, it's just helping the body to process through and to heal from something that's just, it's different, right? It's different. Anytime that you do something to your body, have an impact to the body, or something new administered into the body, your system has to be able to adapt to it. And so that's really where we come in.
And so when I got my first vaccine, my body's response was so interesting because it was literally all of my old issues that I had been going to my visceral provider for. Right-sided tension. I've probably should have asked them to inject on the other side. That would have been
Just
smart.
yeah.
But it was right-sided headache, and I remember I got the vaccine around like 11 a.m. and by that evening I was laying in bed trying to fall asleep, and it was like everything just flared up. And I had a lot of like sensation in my pelvis, my lower right pelvis, which is kind of my joint issue side, and then the right-sided headache, and then heart racing. So it's just kind of all these old health issues that I've kind of worked through in the past and was doing really a lot better.
Yeah.
And so when I went, I think I waited probably a month to schedule something with my visceral person because I wanted to make sure it wasn't like psychosomatic, because I definitely did have a fear of getting the vaccine. But I remember my period that month, my uterus felt like 15 pounds. I was like, oh, this must be what it's like to have like a baby down there.
Oh my God.
But it was just so heavy. And so I finally emailed her, and so she worked on me. She listened at the injection site, and most of it was into my right lung, is where she explained our theory is that it's potentially kind of stuck in here and we need to help your body kind of move it through the system.
Yeah.
And what was interesting when we look at the cerebral spinal fluid, so the fluid around the brain and the spinal cord, mine was hanging out down towards the end of my spinal cord as a protective mechanism, because if it had gone up into my brain, it could have potentially kind of flushed part of the vaccine up in there.
Oh, interesting.
So it was my body's protective mechanism to kind of keep it down away from my brain and my heart.
Wow.
Which is why it felt so dang
Heavy.
Yeah.
That is so fascinating.
Yeah, it was bizarre.
So working through some of the tension around the lung, ultimately, did that allow your body to start to normalize some of that, like the cerebral spinal fluid flow and all that?
Yeah, definitely. It was a pretty... I feel very lucky because it felt like it was a quick response.
Yeah, that's great.
Yeah, just to be able to help the body through that. So we definitely from a vaccine standpoint, we're in the later stages of that. For most people, I know people are still getting boosters and stuff.
Yeah.
But I feel like people who are getting the boosters aren't the people having negative reactions necessarily, or maybe that they don't know.
Yeah, it's possible. I feel like I've heard of, again, we're learning, right? And I think more of that information continues to come out. I've seen one of the patients that I have seen post-vaccine, it was a booster shot that had that reaction to it. But but again, I mean, even in my mind, like when I think about that, I think always with like that pail analogy, right? Like you have like a pail and there's like a threshold that we can tolerate or our systems can tolerate, and it's possible that that water was just getting full or that pail was getting full, and then one of the booster shots kind of pushed that over the edge a little bit and started to have that reaction, even though it's not that tipping point. So it's interesting.
Yeah, so I think, with a lot of the referrals that we get, it's always like, if you have something weird going on that especially if you've been cleared by medical doctors and testing, and they're like, this is just the way it's going to be, or this is your life now, don't accept it.
Yeah, definitely do not accept it.
We're not necessarily saying we're here to fix all of that stuff either, but it's worth a shot. And the things that we've been able to, some of the heart palpitations post-virus or vaccine, being able to relax the nervous system and take the pressure off of the heart has been unbelievable.
Huge.
Yeah.
Definitely.
So lots of really cool things. Any other COVID thoughts?
I don't think so. I think those were the main ones. Yeah.
So we'll keep sharing as we feel stuff. I think a lot of it doesn't change how we assess or treat the body. Where it's just been really interesting to kind of see what we feel, and if we do feel like the body could use some like supplementation support, we have a referral network to help with some of that. If there's, like, I would say we see a lot of the brain fog too, and sometimes it's just relaxing the nerves around the base of the head and getting increasing blood flow up to the brain again. Just balancing that system. So
definitely.
lots of things that we can help out. So
Mm-hmm.
send us any questions
Yep.
you have.
As always.
Yep.
Comment, like, share, post it, whatever it is.
We're not on a platform yet. But
Yeah,
we'll
I
get
know.
there. YouTube.
Yeah, but I hope that
YouTube is
you
good.
ultimately find this information helpful. I
Yeah.
mean, if anything, I would love that if it could at least like help spur up hope, right? Be like,
Yeah.
if you're suffering from any of these weird things post COVID or post vaccine again, that you're just like, man, I'm just gonna live with this with my life. It's just, there's hope out there.
Yeah.
Come get it checked out.
Yeah.
Yeah.
I think when I was at a course recently as a collective, a lot of the providers were talking about how we can feel so much more with our hands than a lot of the technology diagnostic testing. And so it blows our mind.
Mm-hmm.
And we come at it from a humble space that we don't know everything, but like what we can feel is pretty, it's really cool. So
Yeah, absolutely.
Okay. We'll see you soon.
Thank you.
Bye.